Good afternoon. Before we begin, I would like to let everyone know that this session is being recorded and these recordings will become available on our DentEcho website post-session. We are very excited to have all of you join us for the 19th DentEcho. This session is brought to you in collaboration by the Texas Association of Community Health Centers and UT Health San Antonio. Jackie, if you could please share the slides we got prepared for today. That'd be great. And my name is Kato, and I will be assisting facilitating today's session. Next slide, please. And here's our agenda for today. We'll start off with some announcements and introductions, then move on to didactic presentations. And before we move into housekeeping announcements, I would like to pass this over to Dr. Chawla from our DentEcho Hub team. Yes.
Thank you, Kito, and welcome to all of you, and thank you for taking the time. And I'm delighted to introduce today's speakers, Dr. Farrell and Dr. Contreras. Dr. Farrell is the director of Hunke Special Care Dental Clinic at UT Health San Antonio School of Dentistry. She's previously worked as the director of Special Patient Care Dental Program at Advocate Illinois Masonic Medical Center, where she treated patients for over 28 years with special needs. And additionally, she also provided care at Misericordia Homes, a residential facility for those who have developmental disabilities. And right after their program started off in 2015, she's a fellow and a diplomate of Special Care Dentistry Association, and she's also Association's 2021 recipient of Lawrence Chasko Distinguished Service Award. Dr. Contreras is a professor of developmental dentistry and is also our predoctoral director of pediatric dentistry, and since 2016. And she's did her pediatric dentistry residency program at University of Puerto Rico in 2004, and then finished her fellowship at Children's Hospital of Dentistry in 2005. And I'm delighted to welcome both of them and all of you all for this session. Thank you.
Thank you so much, Dr. Chawla. We are very excited for today's session. But before we move into the didactic and case presentations, I have a few housekeeping announcements to go over. Next slide, please, Jackie. Thank you. So these sessions are recorded for later distribution on our DentEcho website. Please stay muted unless you're speaking, and you can also use the chat to raise questions and share your perspectives. The slides and recordings will be made available on our DentEcho website post-session. And to help us with attendance, and thank you for those who's already done this, please enter your name, affiliation, and email into the chat. Please remember that no personal health information is allowed in either the chat or our discussions. And if you would like any assistance with your connection throughout the session, please chat Jackie, who is our DentEcho IT for today. Next slide. And for those who may be new to ECHO, this is a model that builds virtual communities of practice and learning. Sessions include a didactic presentation and de-identified case-based learning, and group discussion to foster deep knowledge and build individual capacity. ECHO is an all teach, all learn supportive model, and ECHOs thrive on the interaction from the full learning network. So we encourage all to participate in the conversation today. We also encourage you to join by video if you can, especially during the discussion portion of the session. Next slide. To receive CDE credits, please make sure to, one, register through Smile, which you can do so now using the link in the chat, or by scanning the QR code. And two, be on the session throughout the duration of the presentation. When registering, please use the super code ECHO 2024. And thank you, Jackie. Please unshare the slides. And Dr. Contreras and Dr. Farrell, whenever you're ready, please share your slides and please take it away.
Okay. All right. Thank you so much for the warm introductions. Thank you very much. Are you seeing the slides? Perfect. Okay, I turn it over to Dr. Farrell.
All right. So for those of you who don't know what a social story is, it's basically a short description of a social situation, which specifically details what a person might expect and what might be expected of a person in a particular situation. They're often used by developmental psychologists to improve the social skills of those who have autism or other neurodevelopmental challenges. What is wonderful about these stories is that they're typically tailored to a specific person, situation, or a situation to help that person navigate through something that they might find confusing, frustrating, challenging. So, because many dental professionals find working with those who have autism to be confusing, frustrating, and even a bit challenging, I thought, what better way to help you to understand how to navigate the provision of dental treatment when working with these individuals than with a social story. The objectives of today's presentation is to introduce you to the neurodiverse world of autism, to share treatment pearls when offering dental care to those who are autistic, to motivate dentists and their staff to welcome these individuals into their practices. The American Psychiatric Association defines autism spectrum disorder as a complex developmental condition involving persistent challenges with social communication, restricted interest, and repetitive behavior. It's considered a spectrum disorder because the degree of impairment in functioning can vary between individuals. The Centers for Disease Control and Prevention has estimated that 1 in 36 children has been identified as having autism. Although it has been found that the incidence is greater in males than in females, recent studies have shown that this may not be accurate because females are particularly good at masking their symptoms. In 2022, the National Institute of Health found that approximately 35% of adults with autism were routinely seen by a dentist, and this number only reflects those who sought care. They identified the lack of dental school training and the provider's general uneasiness as obstacles for dental care for these patients. In 2020, the American Dental Association revised Code of Standard 2.25, requiring dental schools to train students on the provision of care to individuals who have disabilities. Dentists will no longer be able to simply refer these patients out without first attempting to treat. Through this presentation, we hope to alleviate some of that uneasiness about treating these individuals through an improved understanding of the mindset of somebody who has autism. For patients who have autism, having a regimented, daily, predictable routine helps them to cope with the chaotic, confusing, massive events that happen in the world, the sights, the sounds, the people, the places, the smells. One minute change in that schedule can really set them in a whirl. Because dental appointments create such a change, patients that come to the appointments may arrive irritable. As dentists, we may assume that their behavior is because of the fear of treatment, when in reality, it may be a byproduct of their change in routine. Sudden changes in their surroundings or schedule can lead to sensory overload. Sensory overload is when you get more input than your senses from your senses that your brain is able to handle. And it can cause stress, anxiety, and even physical pain. And what you might notice is that these folks will tend to cover their ears or rock, they may repeat the same question over and over. They may repeat the same phrase. And it's best, in order to manage these folks, to let them express their frustration in a constructive way. Say, give them a piece of paper, let them crumple it up, let them rip it up. And then to encourage some calming techniques like taking a deep breath, taking a walk. That sort of thing. And that can really help. Asking him or her to calm down will not. Also helpful is the use of pictograms. Pictograms are drawings or pictures that clearly represent an action or abstract concept. In general, pictograms are used to help those with autism and other folks that have neurodevelopmental challenges to structure their day, to explain steps to task completion, and to understand expectations within their routine. They make communication visual and consistent and can ultimately foster cooperation and acceptance to care. Treatment can be done anywhere. To my knowledge, there's no dental publication that has guidelines on where a patient must be treated. Ultimately, if the patient allows you access to their mouth, proceed with whatever he or she allows and go from there. Typically, I have found that over time, meaning over several appointments, patients will start to trust the process and know you better, and eventually they'll sit in the chair. Additionally, breaks are a must. Fun breaks, even better. Wiggle to music, throw a foam ball, tell a silly joke. Patients love to see that their dentist is in fact human. By the way, breaks are not only good for the patient, but also the provider. Positive reinforcement will increase the chances for good behavior both during the visit and for future visits. Rewards can be as simple as saying great job in between steps that they accomplish and do well, to something tangible like stickers and prizes. Keep in mind that rewards are only incentivizing if it's something that the patient really wants. Additionally, and I cannot stress this enough, do not give a reward if the patient did not meet the expectation you required for this reward, as it can send a confusing message and will not motivate the patient to change their behavior at the next visit. Instead, find something to compliment on a patient for something that the patient may have done well during the visit. For example, I really like how you came into the operatory, or I really like how you came and sat in the chair. And then remind them that there'll be an opportunity to earn a prize at the next visit. Oftentimes, patients will reward you. Unsolicited high fives and hugs can really communicate their appreciation for your thoughtful approach. And ultimately, it will make you want to see more of these patients in your clinic. And you can ask me how I know that. Autism is a spectrum disorder, meaning that no two patients will present the same. Some individuals are higher functioning and need minimal support, while severely affected individuals will require significantly more. And in between, you have patients that require a more tailored approach to support. Additionally, it's important to remember these patients have good days and bad days, just like us, preferences, personalities, and different living situations. Many of these patients lack the verbal skills to properly communicate discomfort or their needs, and as a result, patients may become frustrated and behave in a way that appears resistant. So I want you to imagine that you're in a foreign country and you don't speak the language and you have to seek medical care, and somebody's trying to inject you with medication that perhaps you have a bad reaction to. Not having the ability to communicate, your natural response might be to physically turn away. That doesn't make you uncooperative. It's basically communicating a need. If we consider that behavior is a form of communication, it allows us to better empathize and manage our patients with autism. One thing that I may do to calm a resistant patient is to verbalize in simple language what I feel a patient might be feeling on their behalf. For example, I know you don't like the sharp instrument. It's noisy. It shakes, and I will be done very soon. This lets the patient know that you understand that they're uncomfortable, and ultimately lets them know that you're attuned to what's going on, and it actually can relieve anxiety. The pressure of a weighted blanket, or you can even use a lead apron, or even the swaddling provided by a rainbow wrap, which is basically a very large sized adult papoose board, can be soothing and relaxing to somebody with autism. Dim lighting, noise canceling headphones can reduce overstimulation and provide a sense of calm. Counting down from 20 to 0 or singing the ABC song can give the patient a sense of finality and let them know, okay, a break is coming and when that break is coming. Pre-appointment preparation with a social story such as this, and providing patients with pictograms, say of your office and the different procedures that might be done, will help to promote compliance. Dental findings in those with autism are generally related to dietary preference for sugary snacks and soft foods, which they tend to pouch at the back of their mouths, eating a limited variety of foods, inadequate brushing, and unusual oral habits such as, well, maybe like head banging or picking at lips or pica. Additionally, many caregivers oppose the use of fluoride due to their concerns about neurotoxicity. Empathy is vital when it comes to counseling these patients and their families. So the take-home point, first, remember that those with autism are living in a world foreign to them. Strive to understand what they are trying to communicate to you. To best navigate the chaotic world around them, these individuals thrive on routine. A change to the routine can cause significant distress, and frequently, their distress is communicated with an intense behavioral reaction. Many times, taking a few extra minutes to describe the appointment steps, along with behavioral expectations, using a visual checklist, can help the individual to navigate this unexpected change to the routine. You will also need to be prepared for a change in your routine. Patients may opt to avoid the dental chair. Perhaps they remember being in a similar chair for similar procedures. If the patient is willing to comply, why not just treat the patient wherever they cope best? Positive reinforcement should only be given when it is earned. Now, if you really want to give this patient a prize, go back to a step that the patient was successful at. And I cannot overemphasize the importance of breaks, especially fun ones. Dance breaks are my favorite, even if there's no music or if the patient is sitting in a wheelchair. The most important thing to keep in mind is that when individuals with autism lack language skills, and when they lack language skills, behavior becomes their primary form of communication. And the longer that their primary need gets unmet, the worse and the more intense the behavior becomes. Counting backward can be comforting for these individuals as it indicates when the next break will be coming. Voicing what a patient may be feeling at a time of distress can make the patient feel heard and de-escalate intense behavior. Although there are no specific dental anomalies associated with autism, habits, aversions, and repetitive behaviors can play a role in elevating caries risk, traumatic injury, and gum disease. So now that I've given you a little insight into the nuances related to providing dental care for individuals who have autism, I want to turn the presentation over to Dr. Contreras, who will share case examples to show how she managed several of her patients.
But before we continue, if the audience has any questions for Dr. Farrell.
I had a question.
Sure.
Have you experienced parents that are reluctant or refuse to use fluoride with their patients?
I have several stories about that. One such parent, the parent had said to me that, well, this adult child had been seen in an operating room, had rampant caries. We restored everything, and came in for follow-up. And dad was very reluctant because I went to brush her teeth and give fluoride varnish, and dad was very reluctant to fluoride use, and said he had a whole lot of evidence to back up how terrible fluoride was, and he went on. And I tried to educate the parents, and the parent just would not listen, and took it really one step further. And I said, well, I've given you my information. I guess at this point, we're just going to have to agree to disagree. And a parent kept on, but I've tried to be sensitive to this person's needs, but it can be difficult. Parents really, some of them get misinformed. I mean, we still have patients out there that, parents out there that refuse to immunize kids. So it can be a bit of an issue.
Order of ideas. When a caregiver start reinforcing positively the behavior that is not a great behavior, and they keep on doing it throughout the whole visit, so you take a step back. Obviously, you're not. How would you? Yeah, that happens to us all the time. Oh my God, they're going absolutely. The truth is like,
Or Ricky, you're going in and out.
oh, I'm sorry. A little better.
Yes.
Yeah, just the positive reinforcement from guardians, which are not something that you will consider positive behavior worth of it.
So two trains of thought here. Number one, there's parents. And so they are bending over backwards to sort of fix whatever guilt that they may feel over it. So they that look, you know what? This is what my expectations are. And if you're not, you know, if you're going to act in this way, then I'm going to ask mom or dad to leave the room. That typically will
Trigger.
trigger some quiet. So,
Right. Okay, of course. Wonderful.
Any questions in the chat? Let's check. I don't think so.
Thank you.
Um,
Yes, if you have any questions, please feel free to type it in the chat or let us know.
we'll give it another minute and then we'll continue. Any other questions? Okay, let's. Let's see if this is working for me. Let's begin our case presentation. So unlike Dr. Farrell, she has a lot of experience with different ages of children. My specifics is with children, basically pediatric patients, but I do have teenager patients that I do see, and my oldest autistic clinics. He is not in this, but would not sit in the chair, would walk to the corner, would stay at the sink. But now as a teenager, he comes in, will sit in the chair. We are able to take x-rays. Luckily, with diet recommendations and reviewing oral hygiene, all the good things, this child luckily did not develop any caries, only in the primary dentition. So let's begin our cases. I like to make this a little bit interactive, so we'll give you about a minute or two. If you can join this poll view, you can either send a text, so the phone number you would dial would be 37607, and text CONTRERAS 247. And when you send that, you're going to join. I think I may ask you for your name if you want credits or something, and you should be able to join. Or if you're on a computer, you can join by doing pollev.com and entering that information as well. Let's see how this goes. Give me a second. So the first question for the audience, and I believe if you scan over the QR code, you should be able to. And there we have some responses already. We have, give me one moment, 100% of the participants that are saying that they do treat. We have half and half. I don't know how many. We have 63 participants. So numbers are still coming in, it looks like. Okay. So at least a little bit of half of you, 62 say yes, 62 say no. So it does make a difference. A is for no, B is for yes. Okay. So that's good that we see. And mind you, this is an since this is for different providers. We're talking dentists, nurses, maybe physicians. You are able to select multiple options. You can have a space in between, or you can do a comma. Okay. So we do have some that do not treat anything. I do have 18 and above. So we're looking kind of at the adult population. And we'll give it another minute or so. Okay. So it looks like we have the majority are treating 18 and above. Okay, and we do have some that treat in the pediatric range as well. So thank you for being here. I just wanted to get an idea as to how many we have that treat pediatrics. And of course, those teenager years, because for me, adult teeth are already, it's for adult, then, you know, adult dentition is already past my scope. I like to stick to the ABCs. But thank you for that. I'm going to lock the answers at that for that. And then let's go into our. Someone has to raise, someone's gonna have to verbally tell me something that if they have a question.
We
So-
have we have a question in the chat box, Dr. Contreras.
I cannot see the chat. Can you please read it?
Yes.
Sure.
It's from Brian. When will special needs clinic be open?
That's a Dr. Farrell. It's in progress. We're working through a couple of major issues, but I'm hoping within the next few weeks.
First presentation, we have 3 cases. This is a 7-year-old. At the time when this patient was evaluated, they were here for a second opinion because many people go to different dentists. And sometimes our dental school can be stop number 3, could be stop number 4, that we're getting the 4th opinion. So based on your review of the medical history, they have autism and they also have eczema. That's it. So they are using a steroid cream. In the past, they've had a history of occupational therapy and speech therapy. At age 3, when they first came, nonverbal, the rocking motions, and she had a visit in October. They were told that they had 2 cavities. They were able to do the exam. So the bubbles were the distraction. So for this particular patient, distraction is 100%. So at 3 years, we saw them at in 2020. Again, this is the COVID year, right? So we find C is cavitated, H is cavitated. There's a little stick on tooth B. Well, so what's going on at 3? At least I have all permanent dentition. So for maybe all pediatric dentists or some of them that you were trained, usually we train our residents to make sure that all primary teeth are fully erupted so that you're able to see if you need to, based on the need and the severity, the complexity of the medical history, to see them in the operating room. My recommendations based on the 3 that I found, I said SDF application and possibly an interim therapeutic restoration of gloss ionomer on tooth B. Cover it up like a sealant. Mom was okay. She was even okay with the black, because a big thing about silver diamond fluoride, it's a great tool, an interim to buy me time, is that it does turn black and some people don't like the black. So she did go to the operating room and she got some treatment done. So this is the operating room and these are her x-rays that were taken because no x-rays were able to be taken. So here are her x-rays. She got her treatment. She comes back for a recall. She's now 5 years old. And now she's talkative. She sits in the chair. She allows the exam. We do a toothbrush prophy, but she didn't like the fluoride, you know, but all restorations were intact. She comes back again for a recall 12/20/22. Again, and restorations are intact. Behavior is a little bit better, but she didn't want the suction. So, you know, it's repetitive things, repetitive chair, repetitive staff. Also, For the first time in August of 2023, we were able to take x-rays. And she asked a lot of questions and she's currently reading, right? This is, about 6 months ago. And she had an incipient lesions and we have all the crowns that looked intact. So one of the biggest things that we were working on during this time, especially after the OR, has been diet. Now I don't give her this, we cut back, we brush after meals, we are introducing floss. So a lot of the things was mom making sure that with the diet, and if she was pouching food, which she wasn't anymore, we were able to get the diet under control and she's just been maintaining. So also not only lights, noises, but sometimes in this particular patient's words can set off children. Let's take a look.
I'm using an Explorer. That's all. Good job. You're just making the light. I know. Lights up there somewhere. Yes, I have not. Okay. 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 Sorry about that. Okay, lay down. We're almost done, and then we'll do our vitamins. You got your book. Okay.
Not vitamins, but fruit.
You really? Lay down. Breathe like a statue. Statue.
I can't think of what is that thing?
This is my mirror, remember?
Oh.
Okay. My counter's over here.
So remember, Tell Show Do Come plays a big important part. You missed the part where I forgot. Sometimes we forget because we don't do repetitive things to introduce our instruments and who they are. Remember what this is? I had to reintroduce it because they don't want to know, what are you putting in my mouth? What are you showing? What are you doing? Give me a second. Notice she holds my hand.
Beautiful. We have like Kit Kat. Those are candy style like love. Ooh, love. Seems like it's wiggly too. Oh, let me check. I'm just my fingers. Ear mobility what? G mobility too. Then we have M like mama. I already told you about 23, 24, 25, 26. Let's move to this side. R like Roger Rabbit. Probably I'm the only one that knows who that is. S like Sam, who eats green eggs and ham. I don't know if you read that book. T like Tom. Good job. And 30. Beautiful. Okay. I gotta floss your teeth. Can I floss your teeth?
Some children don't like bubble gum, and what's impedes bubble gum. I have to make specific notes and make sure they're detailed. No bubble gum. I need mint. I need something. Or when they come to the office, they don't like the toothpaste. I say, bring your toothpaste that you like. So
I'm using an
that's
Explorer.
important. Oops, sorry about that. Here we go. And check out this one on the flossing.
Just one right now.
Ow, ow, ow.
Does that really bother you?
I didn't use the word hurt.
But you say oh, okay. Can I continue?
Yes.
Let's try. Okay, turn this way. Oh, you're so wonderful. Ready? Not yet. 1, 2, 3. Give me another one. 1, 2, 3. Let me do this other one. 1, 2, 3. Good job. Out there. Here. 3. And here we go. 1, 2, 3.
Ow, ow.
Oh, do you want to smell it?
What is that? What does that smell like?
Whatever you ate.
What?
Eggs. Open up and say, ow. Stick out your tongue. Stick out your tongue. M1B1. And opera singer. Okay, here we go. Let me finish. Put it back in. Okay, don't bite me. These are chicken nuggets or hot dogs. Good job. Minus. Okay.
So you
ready?
have
I
to do
gotta
a lot of
keep moving over here.
multitasking.
Oh, that's nice spacing. Ready? 1, 2, 3. Big push.
But
Good
my number
job.
one person is
Guess
my
what?
patient.
3. The bottom are done. I just have to do the back on the top. Okay.
Okay.
Thank you.
Ah,
Wow, I better go fast. 1 little, 2 little, 3 little Indians. 4 little, 5 little, 6 little Indians. Hi. 7 little, 8 little, 9 little Indians. 10 little Indians. Boys or girls, which one do you want?
So these are little breaks that I'm taking.
Okay, girls, and then we're gonna go, and 10 little, 9 little, 8 little Indians, 7 little, 6 little, 5 little Indians, 4 little, 3 little, 2 little Indians, 1 little Indian, open, girl. So I just have, oh, it's the one that's mobile. Yeah, okay. That's
Okay. So,
just,
sorry about that. By the way, remember I mentioned in my exam tooth L was loose? It came out. That was done in the operating room. So I re-cemented, no nitrous. We were able to put a new hat. One of the trigger words that got her, no, like she said for floss, or it was glue. I said, yeah, we're just gonna glue back the hat. I shouldn't have said glue. I had to make sure that she didn't see that the glue was on top of that particular one. I'll go back. No, I'm sorry, not go back, going on with the next case.
Dr. Contreras?
Yes.
One question in the chat, do you have
Okay.
any preference for SDF brand?
Any preference for SDF as far as,
Dr. Paddle, if you can clarify.
I don't understand. I'm sorry. Is it in the chat or?
It is in the chat. And
Oh,
I wonder if.
I have no, whatever the school gives me. How about that? I use whatever I have. No particular brand, as long as there's whatever we have. And I'm sorry, I don't remember what we have here.
I know I'm kind of weird on that advantage.
There you go, Advantage something. It begins with an A. Yes, it comes in a little bottle and so forth. Yes.
Thank you.
Okay. Thank you. Okay, going on with case number 2. I don't know what happened. It's a 7-year-old. This one is a male. At the time of the exam, 5 years old. So they wanted to do full mouth dental rehab under general anesthesia. But due to finances, so this happens with a lot of the children or even adult patients. Sometimes they exceed Medicaid's up to age 21. If there is it's a waiver, also with Medicaid or Medicare, there's some type of waiver that maybe some dentists may see or physicians. Great, they can continue with care, but if they don't, then this is the issue, the finances. Where can we see them? Where can we do treatment? So this is an autistic with speech delay diagnosed at age 3. Now medications, just speech therapy. They came in, alternative treatments, again, SDF, and they were able to obtain x-rays on 2/22. Then they had a recall visit, and at that recall visit, the patient sat in the chair on his left side, but very reluctant and unable to get x-rays. I want you to make a note. So patients screaming and crying when brought back from the lobby. So they already recognized the place. Okay. Patient refused to sit in the chair and exhibited combative behavior. Patient walked into the OR chief room while provider was talking to mother. So he kind of went off while mom was talking to the resident about treatment or what to do next. And he met Dr. Shen. So a shout out to Dr. Shen. He's one of our alums who is in Austin area. So he was able to do an exam while standing. And as Dr. Farrell mentioned, you don't have to sit in the dental chair. If you are sitting in this comfortable chair and I feel okay, I can do the exam there. We meet their needs. If they feel comfortable, they feel like they're in control, let's do that. So he was able to do oral evaluation while standing, but Dr. Shen's assistant was able to get x-rays, and mother stated this is the first time patient allowed x-rays. Using a lot of Telsho-Do, that is performed a prophy, but he would not allow toothpaste in his mouth. Mother states patient has an oral aversion and hates toothpaste. So this is the communication or the triaging before they come. What do they like? They don't like loud noises. They do not like lots of light. So it is important. And he, of course, loves T-Rex, green T-Rexes. These are the x-rays. We can see what there is. Okay. We've got a big lesion on tooth K, like Kit Kat. So again, sorry about this, unable to get x-rays on 3/2023, but the carries were arrested with SDF applied. And in September of 2023, after 2 popsicles, we were able to obtain intraoral photos. Patient was standing up and looking at the photos, how they were being taken. So these are the intraoral photos. Of course, we had green popsicles, we had a blue popsicle. That day he had 4 popsicles. He was kind of sick. You can see the SDF on tooth K in the back. It's big and black. Also on J, it was applied. So not too bad. We have alternatives to buy us time. Okay. This patient was actually treated in an in-office sedation in the dental setting school, of course. And tooth K had a stainless steel crown, K had a resin placed, and the SDF was effective. So we let that go for now. It's nothing urgent. The urgent needs have been taken care of, and he's going to come back in September. So sometimes a lot of people want to do full mouth rehabs. Address, yes, if he had an abscess, well, we're going to address that. And some parents don't want to jump in. Some parents would like to dictate, well, I just want to do this, and I just want to do that. You do have to explain all the risks and the benefits of not treating, not doing this. These are the options that, or these are the things that may happen. I believe there's a chat question. Is there a chat question or anything? No? Okay. So we'll see what happens with that particular patient. Give me a moment. And this is case number 3. Again, autistic.
Dr. Contreras,
Yes.
before going into case 3, we have one question. Do you work with the speech therapist as well?
That's a funny question.
So, I have a relationship with the speech therapist here. I mean, obviously, we're not seeing patients yet, but we are already in talks about some collaboration because I know there's a lot of, crossover. We might find patients, like I had a couple of 7-year-olds that walked in with a baby bottle, still nursing from a baby bottle. And that's not my expertise, but perhaps a speech therapist can work toward weaning so that eventually we're not having, that habit continue. So, so I have identified somebody.
Okay. And Dr. Mendoza, it looks like you have a question.
Yes, Claudia. Whenever a parent suggests, well, let's just not work on that particular tooth, or of course, if you do an oral rehabilitation, of course, you're signing your name. I mean, a complete oral rehabilitation. So I always have addressed that like this is a liability matter. I mean, if I'm signing off something as a complete oral rehabilitation, we could not, on a good conscience or a legal conscience, to leave dental disease. How do you address that? Because yes, I have parents that constantly, well, don't address the teeth in the front, just address the back teeth, or things of that nature. But I'm kind of putting my foot down. What do you do?
You have to communicate clearly. This is what worries me because this is going to get an abscess. The teeth in the back are going to stay longer than the teeth in the front. He'll lose the front at a sooner age. You kind of try to explain like the teeth, that's what we chew with in the back. They need to be there longer. We want to make sure we maintain the natural tooth as a natural space maintainer there. Because I remove one, then we're going to end up with more crowding issues. So I'm hoping that I want to address the back teeth first to see how they do. And the front, I can leave a little bit. There are
but if you do an oral rehabilitation, if you do a general, you would not finish the case. Right.
It goes, this is what I tell them on some front teeth. Expect them to be gone. I'm not going to compromise what they want because this is general anesthesia.
Right.
All this that I've done has been in the clinic. One was under sedation, so we're going to see him back in September. This child still probably needs to go to general anesthesia, the second case. But again, remember, it has finances. There's a finance issue there. They can't pay the $3,000 for anesthesia. They can't pay the $2,000 for dental. And then the other whatever from the hospital. Because you have an anesthesia fee, you have a hospital fee, and then you have a dental fee.
Right.
Unfortunately, in San Antonio, For Texas, the Medicaid, we have a lot of children who do not qualify for Medicaid or CHIP because they are not born in the US.
Right.
There are limited programs also that will help them, and that's based on income. It's also based on getting all their paperwork ready, and also based on the funding of certain programs. I was like, oh, funding is done by May, but I may have used all the funding because we saw all these patients and the funding finished.
Yeah, Dr.
Ran out.
Farrell knows our battle here in Illinois, but recently that the tab has been lifted, so we could bill for more units of general under general. They had a tab of 6 units, which was only an hour and a half, sometimes not sufficient. But now that particular limitation has been lifted, so that gave us a little bit of leeway. But I understand that for the migrant community, that which we have plenty of, we have that issue. Yeah.
Well, let me continue with the case. So this one, again, we did a comprehensive exam. Well, they came in for an initial evaluation. This particular last case is special because they were seen by a PCP or nurse practitioner, was placed on an antibiotic. So thank you for recognizing a dental abscess. And they placed them on an antibiotic and they came in. I presented the options to the parent. If she's in pain, you know, she is a little swollen, she's on antibiotic. If you want to do treatment, the options are to do treatment in the dental office setting without sedation, do it today with nitrous and see if it works. Or you can come back a different day and we can attempt a sedation. Mom mentioned that they had opted to do general anesthesia and it would be an hour and so forth. But this is an abscess. This is infection. She's already on antibiotics. We're beginning to swell. We need to take the tooth out, period. So based on what I presented, and it's how you communicate with the parent, they opted to do the treatment in the papoose board that day and with nitrous and try it. And then she came back for the exam, and we'll show you some pictures in a second. Comprehensive exam on March, and she sat in the chair. She sat on the papoose herself, and she wrapped herself. I didn't touch her. She wrapped herself in the papoose board. It's like a routine. She's like, oh, I know where I'm at. I'm going to sit here. I'm going to wrap myself up. And thanks to Dr. Farrell, she introduced her to the papoose board because, I'm sorry, the slow speed section, I couldn't use it. Loud noises kind of scared her. Even when I tried nitrous, the scavenger kind of upset her at the beginning because I hadn't introduced those noises. And in extraction, there really isn't anything but a, surgical section. The very tip is very small. It's not going to hear loud noises. But anyhow, she was able to get into the papoose board and we got intraoral photos. We also got, this is the x-ray of the PA that day that she came in for the limited. There was mobility already. So that's the tooth I took out. Tooth B had the abscess. I was able to get more x-rays as long as I was there. I was able to get but I wasn't able to get the other ones until later. Okay. So we do have another tooth that we're going to have to take out in the front teeth. There are some parents who wish to see them to be nubs, but they want to keep the teeth there, even though they're black or they're broken down, but they don't want us to take out teeth because I take out teeth, I don't replace. So I have some music because I know we're running almost out of time. Please listen to the words with the mom. I'm sorry if the sound is kind of off, but I hope you're able to hear what this mom says. Okay, give me a second.
Elena is 4 years old. We went to many different centers. They're all pediatric centers to do consultations. Each one of them wanted to do multiple extractions. They wanted to do everything in one shot. They wanted to put her under general anesthesia. Some of them said it would take an hour or less. They all emphasized major work, but nobody wanted to take it one step at a time. Well, let's take a step back. Let's see, does nitrous even work? Can she work with nitrous? And over and again, we were told that wasn't even an option. And remarkably, can be an option, and in fact, it is in this case, and it's just a matter of learning how to work with the autistic community, because a lot of them can receptively understand much more than is believed, and it's just a different form of communication. So it goes back to that, just, caring for them like for any individual. Respecting their needs, yes.
And to almost end, and I'll address questions in the end, I want to remind, we have Special Olympics. It's occurring, the Olympics is occurring in Paris, but we have Special Olympics occurring in May. It's the big summer games, and this is occurring at Morgan's Wonderland. And there's some information if you do want to become a volunteer. Sometimes we work in collaboration with UT Houston. I know they will be present on Thursday, some faculty. And I know I and hopefully my volunteer student residents will be there on Friday. And so, well, Dr. Farrell, Friday and Saturday. So if you are interested, there are different events. I'm actually going to another Special Olympics. It's a tennis event. They have different tennis. They have horseback riding. They have different events. If you go to the website, Special Olympics of Texas, you're more than welcome to see how you can become a volunteer. And having said that, I'm going to stop my share and open the floor for a couple of questions before we need to log off.
Thank you so much, Dr. Contreras. That was an amazing case presentation. Any questions? In the learning network.
Give me a moment because I'm looking at the chat. Oh, as a post, please remember to complete your post session survey. Yes. Any physicians, nurses? I know we had different audiences today, but any speech therapists present? No, no. Raise their hands, nurses.
Dr. Contreras, I have a question.
Yes.
What are some of the different ranges of I guess patients that you have with different behaviors on the spectrum?
I have from nonverbal, nonverbal communicative to communicating with a tablet to very talkative. So they range from all over. They do range from different interactions, comprehensions. And like I said, I have one that's now 16 and I started seeing him since he was 5 or 6 and he's changed completely. I've seen a big change. So exposure to therapies, having the resources to have those therapies in all different areas, speech, occupational, physical, whatever it may be, it has helped them. Did that answer your question?
Yes, yes.
Okay.
Yes.
Thank you.
Any other questions? Well, thank you for being with us today.
Oh,
I'm sorry, I do have a question.
Yes.
So I noticed that in your slide, and I think you mentioned that, you primarily treat children. Have you treated adults, and is there any like similarity or main similarities that you've noticed between adults and children when you're dealing with patients?
So I've treated adults. And there's many similarities. The difference between adults and children is basically the size, and some of them have had therapy, some of them have had more time. So sometimes behaviors are better, sometimes they're not. It's all just a variation.
The thing is being prepared. My last adult patient I guess I treated, has been a long time ago, in residency, and I treated a Down syndrome that was 32 years old. And I remember he's very significant because he hit me on my back in a fist. He hit me from behind. That was his behavior. And I was like, oh, okay, okay, let's go on. But, mom was controlling him. There's a lot of different patients. I feel comfortable treating. It's when you have complex adults, not the medical histories insofar, but just like the treatment. Because I can, doing interim therapeutics, applying SDF, if we have cooperation from the parent and it's okay to use a papoose board or something else. I don't know if anyone's ever heard of this, using a pillowcase. And I've taught this to my residents. And you put the pillowcase from behind up to the shoulders and you lay them on top. If you lay them on top of that, they are unable to lift their arms. So you have a control of the hands from them grabbing at you. You would just have to hold the head and the parents can stay at the feet to be able to look, to be able to brush. So a pillowcase is a lot less threatening than a papoose board in some of those cases. And some parents may not want that. I have a parent, one of the patients, no papoose board. She refused. And that's one that went to the operating room.
I think probably the hardest part of treating these families is educating the parents and caregivers. That is probably the toughest part of at least of my job. I mean, I'm fairly certain most of us would agree anyway, but it's hard. And I'm actually the parent to a child with special needs, several children with special needs. And it's interesting because parents have been through a lot. And so they're trying to navigate a world that isn't really particularly crazy about working with them. And so by the time they get to the dental office, a lot of them are spent. And so to, give them information that we think is helpful is sometimes just adding more angst to the day. So.
Did that answer your question, Ms. Tatiana?
Yes, it did. Thank you so much. I appreciate it.
Thank you.
Thank you so much for sharing with us your strategies and that you use. I appreciate it. Thank you, Jackie. So it's almost 1. So we want to thank you so much for joining us for the 19th Bendeco. Please complete the post-session survey. I believe the link has been shared in the chat. And next slide, please, Jackie.
And thank you for treating those special needs.
Yes, absolutely.
Okay, it's patience, distraction. Thank you very much.
Thank you. And please join us for our next session in May with Dr. Gonzalez. We will be hearing on HIV and oral health among children. And we hope to see you in 2 months for the next echo. And again, thank you so much, Dr. Contreras and Dr. Farrell and everybody else for a great session. Thank you.
Okay, thank you.